Nice to be back with you, Dr. Strang. And good afternoon, everyone, and thanks for joining us today in the room and online. Today is an opportunity to update Nova Scotians about our back-to-school plan and the hard work that's underway to welcome our children back to school next week. Regional staff and school staff and principals and vice principals and many teachers are working hard to get schools ready for Tuesday. I know many children are excited about getting back to school, so thank you to everyone who is working long hours to ensure a positive back-to-school experience for our kids. And again, we've had great custodial service folks, our principals, our VPs, teachers, support staff. Everybody's working to make this happen. Dr. Strang will provide more information about how we will respond to potential cases of COVID-19 in our schools today as well. And I would like to provide an update about how we will support students in our classrooms. Over the last 2 months, Dr. Strang and I have spoken to you on multiple occasions about Nova Scotia's back-to-school plan. We talked about spacing of desks, cohorting of children, and the need for enhanced hand cleaning and sanitization. We outlined the health and safety measures in place so children can return to school safely. We talked about the need for masks on children in grades 4 to 12. We outlined the additional investments for operational staff, bus drivers, and lunch supervisors, cleaners, new computers, and more in-class supports as well. But the thing that hasn't changed since we released our plan in July is the importance of getting our kids back to school. Schools where children access technology, food in many cases, teaching specialists, and mental health supports. It's where our children access their friends and where they learn the best. School is a key component of our children's emotional, physical, and social development. We've heard that from developmental specialists and pediatricians across the board. And public health and pediatricians tell us it's safe to send our kids back to school at this particular time because of the low rates of COVID-19 in Nova Scotia. This is an enviable position to be in. And they've provided solid guidance and advice around our back-to-school plan. With the guidance of public health and the IWK, along with our union partners, we have worked on a plan that gets our students back and allows us to respond to any changes in COVID-19 as they develop. The same approach was taken with licensed childcare, and that sector has been reopened safely for more than 2 months now. When we opened childcare, people were afraid, naturally. And operators had questions, as did parents. We understood that fear, and we understand that concerns and questions that you have about going back to school as well. All along, we've said this plan is flexible. All along, we've said we will adapt to changing conditions. If our COVID situation in Nova Scotia changes, we will move to blended learning or at-home learning model, and this can happen again locally, regionally, or across the board. We have a plan for all those situations. But learning from home is no replacement for learning in the classroom. So when school starts next Tuesday, I want to remind you that principals, teachers, staff, and administrators will work to ensure a positive experience for your child. Together we are offering a full curriculum. There will be modifications in some courses like band and music, the guidelines of which are all posted. School sports will go ahead with modifications, and the Nova Scotia Athletics Federation has posted the new guidelines around sports. And we will continue to support families with children with disabilities and additional needs. A new inclusive education policy announced last September will come into effect, and the back-to-school plan ensures that students can access the support they need where they need it while observing COVID-safe practices. Those supports will be in place during all phases of learning, at home or in school. Pre-primary is going ahead around our province, and there will be report cards and assessments as per usual. What will look different is how we respond to sickness in our schools. We recognize that at times students may be sent home if there is a COVID case in a class or a school. And I want parents and students to know that our system is ready to support students at home. We are suspending parts of our attendance policy so students will not be penalized for staying at home. If students need computers to work from home, they will receive them. Our teachers are ready to support students, and we are setting high expectations if children need to work from home. We provided professional development support for teachers this summer to help them with remote learning. Over 1,000 teachers took us up on that. We have over 100 courses available online right now for free for teachers who want to enhance their capacities to support students during our remote learning phase. And of course, all the teaching and non-teaching specialists we've hired are there to support teachers and student learning during any of these phases. And for more information about how public health will respond to potential cases of COVID-19 in school, I do want to pass the microphone over to Dr. Strang.
Thank you, Minister Churchill, and good afternoon, everybody. I'm going to start by giving an update on our cases here in Nova Scotia. The last briefing I was at was on last Wednesday, August 26th. Since then, we've announced 4 new cases and 2 probable cases of COVID-19. So as of today, we have 6 active cases of COVID-19 in the province. Our total numbers so far are 1,085 cases of COVID-19, with 76,935 people who have been tested with negative results, and we have had, unfortunately, 65 deaths. The Nova Scotia Health Authority's lab completed 961 tests yesterday. 2 of the cases of our 6 that were recently reported were in the northern zone and were connected to previously reported cases, close contacts of previous cases in that area. An additional case was identified in Eastern Zone, and that individual, it was related to travel outside of Atlantic Canada, and the individual had been self-isolating as required since their entry into Nova Scotia. The 4th individual was identified in Western Zone, and as was being reported publicly yesterday, the individual is a student at University St. Anne, and appropriate public health measures have been put in place working with that university. We also announced 2 probable cases of COVID-19 at 2 universities, one in Dalhousie and one at Acadia in Wolfville. Both students are from outside Atlantic Canada. They both live off campus and have been self-isolating as required. So let me talk a little bit about probable cases, because those are new to many folks, and it's certainly something we anticipated when we started down the road of testing large numbers of students without symptoms. A probable case means that the test result was, the lab calls it indeterminate, which means that it's not we can't confidently say it's negative or positive, so it's somewhere in the middle. And we fully expect that when you start testing a lot of people without symptoms, we know from experience previously with COVID or with other diseases that we are going to start to get more and more of these indeterminate test results. There are a few reasons why a test result may be classified as indeterminate. If someone has previously had COVID-19, they can still, for weeks afterwards, even though their infection is cleared, they can still have some residual virus in their nose and throat, and we're picking that up with a test. It does not mean that they're still ill. It does not mean they're still infectious, but that residual particles of virus DNA can still be picked up on the lab test, and you can give you an indeterminate result. It could also mean that somebody has been tested very early on in their infection, and they may not have enough virus to give you a full positive result. So again, they could be indeterminate, but it's because they're very early on. We can also have issues around a cross-contamination in the lab potentially, or a cross-reaction from another viral infection that somebody has. So in each of these situations, when we have an indeterminate result, the local public health folks working with the regional medical officers of health, we work closely with first the lab, and then with the individual who's been tested and any other physicians involved to look at their clinical symptoms to try to categorize their indeterminate case. And ultimately, we're looking at a number of factors to say, is this somebody who is either an old case and that we're just picking up well after the fact and we don't have to worry about that anymore? Is it a cross-reaction or cross-contamination that we have just to be aware of more in the lab? Or is it one of these cases which is very early on in a new case? And if it's the latter, if we consider this to be a new case, then we're going to treat it like any other case of COVID-19, require isolation, do contact follow-up, etc. So I think it's important that we understand that people understand this new category of test indeterminates and probables, but to be reassured that public health does the appropriate assessment in each and every case to make the right determination, and we will always err on the side of caution of calling it a new case if we're not certain, and then doing all the measures like we do with any other case of COVID-19. With both our probable cases to date, we used our expertise, and we actually made the determination that there quite possibly could be these very early on cases, and then we took all appropriate steps to isolate them, identify any contacts, etc. But fortunately, both cases had been following the self-isolation rules required for university students, and there hasn't been any broader exposure. So again, we have now identified 1 positive case and 2 probable cases amongst our post-secondary students. That's good news because we are testing hundreds of them, and we fully expected to get some positives. We've gotten 3 so far, so that's a very low percentage of positives. So to me, that's a signal that, and it reinforces why having this testing strategy for post-secondary students coming from outside of Atlantic Canada was absolutely necessary. People need to understand that because of this testing, these 3 individuals, we were able to identify them quickly and manage these cases. But I think it was important that people, especially the post-secondary students, understand that just because we have a testing strategy, that doesn't mean that they can disregard all the other public health measures. In order to keep all our communities safe, that we need to continue to need all the students coming from outside of Atlantic Canada to complete their self-isolation, do their daily digital check-ins, and to follow up with their testing protocols. And if they do, we're reminding the importance of all students to be isolating. If they're not sure of the rules, isolate and ask questions and wait and stay isolated until you get the answers. So let me move on then to today's major topic, which is our public schools. Last week, I did talk about the public health measures that are being implemented in schools across the province, and then the fact that we have a back-to-school plan that will allow us to strengthen public health measures if necessary. If our COVID-19 activity increases, we certainly have the ability to strengthen the public health measures and continue to have safe spaces in our schools for teachers and students. There certainly continues to be a lot of discussion, and concern, and even some criticism about what will happen in schools if COVID-19 does occur. And I want to make the statement today, and as I made it before, I fully expect we will get cases of COVID-19 in a school. It doesn't mean that the plan has failed. It doesn't mean that there's a crisis. It simply means that what we expected to happen has happened, and then we will respond appropriately. But I think people have an expectation that we're somehow going to have no COVID in schools, and that if there is COVID, that somehow there's been a big failure. That is incorrect. We expect to get COVID. We have plans in place to manage it appropriately. So public health is well prepared to deal with COVID. We have plans in place, and as I said last week, even though this isn't a template or a cookie cutter approach, we will take a very cautious and timely response. And I'm going to lay out some of the framework that we will take in more detail today. But ultimately, the detailed actions will be dictated by the specific circumstances that are occurring in any given school. But let me share with you today some of the information about the key elements that staff, students, and parents can expect in a response to COVID in schools. That response is determined based on answers to a few key questions. So we'll be looking at information on is the individual who has tested for COVID, are they a student, a staff member, or an essential visitor? Is it a single case, or are there other confirmed cases in the class or the school? What type of exposure or risk to other students, staff, and visitors has occurred in that school? Where did the case likely get infected? A critical question is, with any case, you say, well, when would they have been contagious? When would they have been able to spread the virus to others? And then where were they in the school during that time, and what were their activities while they were potentially infectious? One of those questions is important to us. How do they get to school? Were they on a school bus? Do they participate in a before or after school program? So that's all the type of questions we use to get the detailed information to basically make a determination on who else might have been exposed to this individual and then be at increased risk for COVID-19. So we basically put people in 3 groups of exposures. So a student or teacher would be considered at higher risk if they were a close contact of a case. And a close contact is someone who has been in close, so within the 6-foot distance, and prolonged, a minimum of 15 minutes contact with a confirmed case. And we start with the up to 48 hours before that confirmed case became symptoms. So starting with 48 hours before that case became sick, who were they in that close prolonged contact with, and anybody who they were is then put in determined as a close contact of the case. So for students in cohorted groups in elementary and junior high, this is likely to include all the students and staff within that classroom cohort. For higher grades, the students who are non-cohorted groups, this may include all the students and staff in each of the classes that the case attended. We're also certainly going to look at anyone else who's been in close, prolonged contact with the case outside of their cohort, including things like individuals who they're on a school bus with, if they were in other before or after school programs, family members, friends, other community activities. We consider someone to be at moderate risk if they have not had prolonged contact and they have maintained that minimum of 2-meter distance, but they may still have been in the same classroom or the same program as the case. So, for example, this would include if there are students and staff in a shared space like a classroom who are able to maintain that physical distance of 2 meters at all times from the case. We would call them then a moderate risk of being exposed. And then finally, we have people who would be considered at lower risk if they've only had brief contact with a confirmed case. So this would mean anyone, for instance, who's only had incidental contact. So if the only exposure could have been they were walking past each other through a hallway or another common area for a very brief interaction, that really isn't a significant risk of being exposed. So if that's the only contact somebody had, they would then be put in that lower risk. So as you can appreciate, there's a lot of work for public health to say, where has that person, the case, been? What have they been doing? Who else was in those spaces? And what were the type of interactions that happened? But that's the work that we do every day with all types of other communicable diseases, whether it's measles, whooping cough, etc. We do this on a regular basis in a school environment. But it's that assessment we would do. The first step is to say, are people a close contact, a moderate contact, or a low-risk contact? And at this point in time, the approach, the steps that we're going to take with both the higher risk and the moderate risk, we're going to take the same approach. We're going to err on the side of caution and treat moderate and higher risk the same. As we get more experience with this, we may be able to say that we don't have to be as cautious with moderate risk. We'll see what experience we get. But we're starting out, our premise is always to err on the side of caution. So the key components of our response is that as we start to do our investigation, once we identify these close contacts, we arrange testing as quickly as possible for all of those individuals. And then anybody who's deemed to be a close contact and is tested is required to isolate at home while they're waiting for the test results. If their results are negative, then they will need to continue and complete their 14-day isolation period because they have increased risk of being exposed. They have to stay isolated for that full 14-day incubation period before they can come back to school. Individuals who test positive are now themselves a case, and then it creates they then have to isolate because they're a case, and then they generate their own circle of contacts that public health will then investigate. I think it's important that parents understand that there's a possibility that any of their children in school, or teachers, for example, themselves, anybody in a school environment could be in a position where they have to be isolated at home for 14 days before they get a test, and if they test negative, continuing the rest of that 14 days. So teachers and parents and students should now be thinking about having a plan in the possibility that he may be at home for 14 days and how that's going to be managed at home, and keeping people isolated as much as possible at home. Isolation means they're not to be out and about in the community. They basically have to be staying at home and keeping isolated as much as possible, even within the home environment. Public health, we throughout that 14 days, we keep in close contact with those individuals and monitor them in case they do become sick and need further medical and then convert from a case, or sorry, from a contact into a case. The other piece of this is important, that once a key piece of our immediate response in a school, if there's a case, will be communication to families and to teachers within that school about the situation that's going on and what the information they need to be aware of, and what steps, how they need to be monitoring their health, and what, if any, other steps they need to be taking. So communication within the school and for families who associated with the school is an important priority for part of our public health response as well. If a student becomes unwell or develops new health symptoms while they're at school, we certainly have plans in place that teachers and administration to recognize that as early as possible, isolate the student away from the rest of the school as quickly as possible, keep them monitored, and then to contact with family members, parents or caregivers, to have them taken home as quickly as possible. It then becomes the responsibility of the family, the parents or caregivers, to then continue to then follow up with 811, doing our message for everybody is that whether themselves or their child becomes unwell or develops new health symptoms, the first step is to isolate. The second step is to do the 811 online assessment, and if you don't have internet access, calling 811 and get further direction around the need for testing based on from the advice from 811. And that's a critically important that people understand that. Today's about schools, but that message is for everybody. If you're unwell, you should be stay at home or get home as quickly as possible. Do the 811 assessment. Keeping people who might have COVID away from others, isolated at home until we get an assessment and get them tested as necessary, is a critically important part of how we prevent the spread of COVID in our schools and in our communities. I certainly hope we won't have to close a school, but we need to be realistic, and we're certainly prepared to do that if that's what is required based on the public health assessment and discussion with the school administration. Our foremost priority is to keep students and staff and our other people in the schools as safe as possible. That I need to emphasize that a school will only close due to COVID-19 reasons based on the advice and the recommendation from public health, and that would be we'd close down a whole school only if we felt that there was increased risk to all staff and students. It's much more likely that we're going to be in a situation where we're closing down a classroom because there's a case within a cohort within that classroom. But we are prepared, if necessary. We would take the step if necessary to close down a full school. We hope we won't get there, but we are prepared to do that. And let me talk a little bit about immunocompromised students and teachers, because we're getting a lot of questions on them as well. I certainly know that parents who have immunocompromised children and teachers who themselves may be immunocompromised have even more concerns about this school year, and I understand where those concerns are coming from. But there are processes in place to deal with that. Certainly, there's well-established processes for teachers through their human resources in the education system that are in place through the regional centers for education. The IWK Pediatric Advisory Group has been providing direction about who qualifies as immunocompromised. I mean, there are a lot of people who feel they're immunocompromised, but there are very specific medical criteria to who is truly immunocompromised. So it's important that that people are given the right guidance to make an assessment of whether they truly are immunocompromised and therefore at greater risk for COVID-19 versus a feeling that they might be immunocompromised, but really that is not there's no medical facts behind that to really say that they are immunocompromised. So there are specific guidance available that has been made available through the education system for families. It's available for physicians to make that determination of a child whether they truly are immunocompromised. Many of these children are already well known to the education system, and there's a well-established process in place for immunocompromised, maintaining the safety of immunocompromised children in the school system, and what actions may need to be taken if there's a range of infectious diseases, because often it's an infectious disease, whether it's a measles outbreak in a school, whether it's COVID-19, that puts that immunocompromised child at increased risk. So at the end of the day, we would encourage parents who, if their child is immunocompromised, is to have the conversation with their physicians and continue to work with the school system to have specific plans for the individual child. And as I said, the IWK is supporting the education system around those detailed issues around specific children. And if your child is immunocompromised and does need to stay at home, I've certainly been confirmed to me by Minister Churchill and others in the Department of Education that there are processes in place for those children's learning to continue to be supported. I also know that there are teachers, staff, and students who live with immunocompromised adults, and that also creates worry. And certainly no one wants to transmit COVID to a loved one, especially somebody who is at higher risk of complications from the virus. And that, I come back to, that's why it's important that all of us continue to practice public health measures, whether we're in schools, whether we're other workplaces, whether we're out in the community. It's critically important that we all practice our public health measures of keeping physically distanced where possible, wearing masks, hand washing, and minimizing the chance of any of us taking an infectious disease back into our homes. So this will be a school year like one we haven't seen before. That's certainly true. COVID is creating change in every part of our society and communities. But I'm certainly continue to maintain that the best way to protect our schools and everybody in them is to keep community transmission low. That's our focus. We have a very low level of COVID activity in the province. We need to continue to maintain that low level of activity, and how we do that is things like we're doing with university students, the quarantining and the testing, minimizing the chance of introduction of COVID into Nova Scotia, as well as all Nova Scotians continuing to follow the public health directives on physical distancing, gathering numbers and masking, and practicing good hygiene like hand washing and regular cleaning of common surfaces. If we all do that well, we will keep COVID at a very low level, and we will continue to have the ability to have very safe educational environments, whether it's the public schools or our universities. But we have to remember, and hopefully people have been reassured today, that if COVID-19 is identified, public health is positioned to act quickly to identify and test anyone who may be a close contact and to minimize the opportunity for COVID to spread further within that school. I just want to take a minute to talk to parents and to ask them, if they haven't already done so, before we get to Tuesday in school, it's important that you talk to your children. Help them understand what will be expected of them at school. Things will be different. Mask wearing is one example. Talk to them about any fears they may have. It's perfectly, and help them understand that it's normal to be fearful, normal to be anxious, that this is a very different situation. So those feelings they have are actually normal. Help them appreciate that those are normal. But then we need to work with them to give them some tools about how they deal with that, and very often giving a sense of control by teaching them about how to wear a mask properly. Focusing on how do they making sure they know how to the importance of the frequency and how to wash their hands properly, helping them understand the importance of physical distancing. Those are all things that gives them control and helps them manage their fear and their natural and normal fear and anxiety. Again, I emphasize my message that it's critically important that families understand that if a child is feeling unwell or develops new health symptoms, they should not go to school. They should stay home, and then an 811 online assessment should be done. That's critically important that we keep kids who may have COVID out of our schools. It's all these steps together, that everybody working together to keep our communities COVID safe. We will also keep our students in school learning and socializing. Minister, back to you.
Thank you so much, Dr. Strang. And to follow up on Dr. Strang's point around getting our children and older students ready to get back, we've got resources online which include some videos. And we encourage parents, teachers, students to familiarize again themselves with the reference points and the information that's available online to help get ready for next week.
Just a reminder, we'll take one question and one follow-up from reporters in the room as well as reporters on the line in the allotted time that we have for today's briefing. We will start with John McPhee from the Chronicle Herald. Go ahead, John.
I guess this would be a question for the minister. I've talked to parents who are still feeling quite a lot of anxiety in terms of the desks. Like it's simply not feasible to keep kids apart and not have a risk of exposure. And I talked to a parent today who said if there's not big changes made to your plans in terms of reduced class size, that kind of thing, they will withdraw their kids from school. So I guess my question would be, how prepared is the system for a large number of people not sending their kids to school?
Well, I mean, that doesn't create a problem for the system if that happens. You know, we want first and foremost our children and older students in Nova Scotia to have access to high quality education. We believe that we have a plan in place that prioritizes everybody's safety as we get kids back to school. Social distancing is but one aspect of this multi-layered plan that is prioritizing everybody's safety and balancing the needs of our learners and our teachers as well. So Dr. Strang is probably better poised to answer the health and safety component of this than I am.
Yeah, so the minister is absolutely right. I think there's been an unfortunate focus solely on physical distancing and 6 feet or 2 meters. That's important, and it's a key part of our public health measures, but we have to understand the first and foremost, that we need kids to be able to be in school. That we have to do that safely with COVID, we have a package, if you will, or a range of preventive measures that work together in a complementary manner, starting with keeping kids home from school and getting them assessed if they're feeling unwell, to masking on buses, masking in hallways, increased cleaning, increased hand sanitization, older kids, grades 4 not wearing masks in schools, keeping separated as much as possible within the classroom. All those together provide, I believe, the appropriate level of safety for where we're at with a low risk of COVID occurring in school. If we get an increase in COVID transmission in a community or broader in the province, one of the very first things we do is shift to the blended model, and a critical part of that blended model is a strict adherence to 6 feet or 2 meters within classrooms. So I think we need to understand that we have a package of measures together that provides the appropriate level of safety for our current COVID epidemiology, if COVID becomes more, increases in frequency in a community or in a part of the province, we change the model, we strengthen the public health measures. And a key part of that strengthening is a stronger adherence to the 2 meters. So again, I think people are focusing on one piece where they have to look at the package of public health measures that go together to create an appropriate level of safety given where we're at with the epidemiology.
Go ahead, John, with your follow-up.
The response protocol that you just went through in terms of the close contact, moderate, and low risk levels, how did you come up with that? Did you, how different is that response system to the response to a COVID outbreak, say, in a business? I'm just trying to...
It's no different. We know, like with any disease, we take how is it spread, and then we come up with a definition of what constitutes a close contact. And for this, that definition of is having exposure within 2 meters or 6 feet for more than 15 minutes. It creates a close contact. And that we use that definition regardless of it's a school or whatever the setting is. But we were emphasizing that today to help people understand that the type of thinking we go through is once we have a case, we assess who the case was, who might have been around them, and what type of exposure happens, and then we put them into categories of contact, and then our public health measures such as testing and ice, and then requiring them to be quarantined for 14 days are determined by what, because the exposure determines the risk that they may themselves come down at some point in the next 14 days with COVID. And it's all based on keeping them, that contacts, isolated, so if they become sick, they're not spreading it to anybody else. It's all part of, it's standard public health. You identify cases, you isolate the cases, you quarantine their close contacts, and that is how you break transmission cycles and minimize the chance for broad spread within a school or any other setting.
Next, we'll go to Cassandra Nadeau-Lamarche, Radio-Canada. Go ahead.
Merci. This is for Dr. Strang. So sorry if I missed this, but you said that so for moderate to high risk, there will be isolation. But what are the measures for low risk contact?
Low risk can continue to be in school because if they're judged to be at low risk or they've had no exposure whatsoever, their chances of them actually developing COVID-19. The reason we're saying they're at low risk is because they've only had at the most, they've had a very transient exposure, and the likelihood of them being infected is extremely low. So they can go about their activities as normal. As I said, if they're moderate or high, right now we're treating them the same, and they're isolated. They're out of school, isolated and tested, and then followed up depending on the tests. If we get enough experience and we learn that, you know what, the moderate people who are in the moderate category have a very low chance of actually turning positive, we may take a less aggressive approach with moderate. But that will only happen if we get enough experience with that level of exposure. Right now, we're going to all err on the side of caution, as I said, and treat moderate and high as the same.
Go ahead, Cassandra, with your follow-up.
So this is for Minister Churchill. At the beginning, you mentioned that if someone needs a laptop, they will have one. Does that mean that every kid will have access to one, or are there limited amounts of laptops? Because I know the Cape Breton Regional Center for Education has some for every kid's grade 6 and up, and I'm thinking CSAP too. So is this something that's all over the province, or?
Yes, as we've mentioned in a previous press conference, we've purchased 14,000 devices for students in the event that they need those, and we'll also be using some of the federal money that's come to our province to purchase more to make sure that any student that's in need of a learning device laptop primarily will have access to it, particularly if we have to move to a blended or at-home learning model.
Next, we'll go to Natasha Pace from CTV. Go ahead.
I just wonder if there's going to be any extra support for kids to help them adjust to this new normal in schools for either.
Yeah, so we do have, of course, the resources online to help parents get their kids ready to get back to school. And again, we encourage people to do that. We've had professional development for teachers over the summer. Over 1,000 over 1,000 teachers in the province have taken us up on that. And of course, we've had our additional teaching and non-teaching support staff that have been hired every single year. You know, we're with this round of inclusive education hires, we're well over 400 net new staff positions to the system, and those staff can and will be deployed in a way to help kids in whichever way they need. Those are mental health clinicians, child and youth care practitioners, and teaching assistants, a whole host of new staff that can be deployed to support students, and teachers as we all adapt to this new learning environment.
Also wondering, it seems like there's going to be a lot of parents, a lot of guardians who are off work if students have to be at home. I'm just wondering if there's any thought to any type of plan or paid sick leave. I mean, if people have to be off work for 2 weeks, that's obviously going to be a huge strain on the pockets of a lot of Nova Scotians. Is there any thought to that?
Well, I mean, we know getting our kids back to school is really beneficial to working families, of course, on top of the more important immediate and long-term benefits to the students themselves. It's also why if we move to a blending learning model, it's going to be our older students that learn from home. They're a higher risk of transmission, but also they're easier to manage for parents being at home compared to younger students. And you know, this is something that we all have to work on this together. I've heard the Premier and Dr. Strang say this. We're encouraging families to work with their employers and encouraging employers to work with their families to accommodate whatever situations do develop during this time. And it seems that people have been doing that successfully to date, and we expect that to continue.
Next, we'll go to Michael Tutton from the Canadian Press. Go ahead.
Dr. Strang, could you explain in more specifics what triggers an outbreak and whether that's within a school that leads to the blended model being triggered, or is that system-wide? But what does it, give parents and the public a bit more of a picture? What's an outbreak look like? What's the trigger?
So an outbreak would when we're having cycles of transmission. It's not just an isolated case, but we're seeing it being transmitted from one person to another, and whether we say it's the geography around that, whether we say it's an outbreak in a school, an outbreak in a community, depends where those cycles of transmission are happening. What we'll be looking at is increased COVID activity where we know that the transmission is happening within that community, whether it's within the school or within the community, which might then lead us to then say we have increased COVID activity in this geographic area, and then therefore we may have to have a different model, move to the next level, the blended learning model, for example, in this individual school, or maybe it's the family of schools within a community. So it's really a signal that where we're seeing that there is increased transmission within that setting, within the school or within that community. That would be what we're looking for and to then we then start to consider, do we need to go to to that blended learning model as part of our response to create conditions which apply a higher level of safety and allow us to actually slow down and ultimately stop ongoing community transmission.
Go ahead with your follow-up.
Minister Churchill, if you look at videos from the private schools around town, they've got every desk 2 meters apart and a plexiglass divider between them and thermal thermometers, and they're based on surveys to give peace of mind to the parents. And just further to my colleague at the Herald's question, it seems like some parents are not confident yet in the safety of their children, their peace of mind, let's say with the thermal testing, for example. Why not spend a bit more time working on the desks, checking out the idea of the thermometers, giving the parents more peace of mind?
I mean, so there has been built-up tension in every single sector before the opening. You know, we experienced that in childcare. As a parent, I was very nervous about getting back to childcare. You know, it was weird leaving the house and going to the grocery store at first, you know. I think once people get back to school, get used to the new measures that are in place, get used to the new habits that we all have to develop with COVID hanging over our shoulder. I do believe, and if we can do that without seeing any major issues, and people see that the health protocols and safety protocols are working, I think that will help with the reduction of anxiety. And I just want to reaffirm with everybody who's nervous about this. We've put a lot of thought into this. We've worked with pediatricians, some of the best pediatricians in the country. We've worked with Dr. Strang and his officials at Public Health. We've worked with our union partners and continue to work with all those groups to monitor the situation, to come up with a plan that allows us to get back to school, get all of our kids back to school, and do so in a way that is relatively safe. Recognize that there's a higher risk for everybody that's back to work or back to school in this situation. So we're taking that layered approach. We've got mandatory mask wearing for grades 4 and up, from bus to classroom. We've got enhanced sanitization and cleaning protocols. We're cohorting as much as we can. Obviously, that's more for the younger students than for the older students, but we're scheduling our older students. Everything we're doing is to reduce risk and get our students back to school. And it's a different system when you're looking at running a public education system that has 120,000 kids in it, students in it, or we've got staff of around 10,000 plus. It's a very different situation to manage that system than to manage one private school. And I think that we're leaning on the best advice possible. And I've taken, trust me, we're all wondering about this, right? But we've really leaned heavily on the advice from public health experts. And public health experts across the country are actually pointing to Nova Scotia's back-to-school plan as one of the better ones in the country. So I do take comfort in that myself.
So let me also comment, just because people are doing things doesn't mean that they're necessary or appropriate. Temperature screening is a good one. There's no evidence that temperature screening is effective. It's not the way to screen people for COVID. If we had felt things like plexiglass and temperature screening were necessary, we would have recommended them from public health. There is no public health guidance across the country that is recommending these kind of measures. So I think we just have to be cognizant as well that just because some institution is doing it doesn't mean it's necessary that's a gap in what we're doing.
Next, we'll go to Rebecca Brown from All Nova Scotia. Go ahead.
My question is for Minister Churchill. It's on ventilation. Where are you at with the school-by-school ventilation inspection? What have you found so far, and when will the findings be made public?
So the vast majority of ventilation checks are already done. Any maintenance that's required is underway. I was just most recently on the phone this morning with our regional executive directors. They assured me of this. So there'll be no outstanding ventilation checks or maintenance heading into next week. They'll all be completed.
Go ahead with your follow-up.
And for Dr. Strang, I'm hearing that some individuals who've been told by 811 that they need a COVID test aren't able to get a test. So I'm asking, is there a testing shortage? And what is the province doing to increase testing availability?
So there's no shortage of testing. I don't know the details of why it can be a bit of a time lag sometimes, but certainly people who screen in and get an appointment for a test, they can get a test. We have significantly invested in our capacity both in 811 as well as the primary assessment centers through the health authority, as well as the laboratory capacity to handle all those specimens. It's been a key part of our strategy, and I think a key success for Nova Scotia. And we continue to do that. We've added on a substantive requirement to test large numbers of students, and we're doing that well. So I'm not aware of anybody who's not been able to get a test that may not be quite quite in the time frame they'd like, but we have to recognize that for any lab test, it takes some time to get the appointment, to get in to get tested, and to get the result back. But people who are deemed or are screened in by 811, they can get a test.
Next, we'll go to John Tatry from CBC. Go ahead, John.
Thank you. Journalists toured 2 spacious, airy schools today to see how all of this is going to work. How have you tailored those plans for older, more cramped schools?
I'm sorry, John, I couldn't catch all that. My apologies.
We journalists toured 2 spacious, airy schools today, and you could see how all of these plans were going to work. I wonder, how have you tailored those plans to older schools that are more cramped, where it won't work as easily as it does?
Oh, that's where the other safety measures come into play. So, listen, without keeping half our kids home, we cannot reach full. Then we can move to a blended learning model, and that's part of the education jargon. I guess I picked up blended learning. That means half our kids are staying home, and that's the older half. But if we're lucky that we don't have to do that right now. We can actually get all our kids back, and do so with the approval of public health.
Go ahead, John, with your follow-up.
And I wonder, if, particularly for elementary school, what the pickup and drop-off will look like next week. Usually it's hundreds of students, hundreds of parents milling about the playground, and then everybody crams in through a few doors. So what should parents expect? Drop-off same as normal, pickup same as normal, or how is that going to be adjusted?
Well, people will be wearing masks. Busing schedules are being organized locally to minimize congestion. And of course, access to our school facilities is not as open as it was. So there's very limited access to our school properties. So those would be three big changes that I can think of.
I'll just add, this is an area where we ask, the parents need to take some responsibility. What are they going to do to stick to keeping separated from other parents and other dropping off their kids? It's important that each of us understand what we're and think about what we're going to do to create safe school environments, and not just say, well, what's the school going to do about it? So coming into those school drop-offs, parents need to think about and be cognizant about how they're going to manage this safely. And that safety includes masking and keeping distance from other parents, and not expecting to be all dropping off all at the same time and all in a very tight location.
Next, we'll go to Elizabeth McSheffrey with Global.
Minister, lots of kids rely on the work of specialists, OTs, speech paths, and a lot of those specialists travel from school to school. Will they be traveling from school to school this year? If yes, how are they going to respect cohorts, and how does that line up with safety measures? If not, how is the department going to ensure that everyone who needs access to a specialist will get one?
Yeah, very, very important question. One we have touched on before, but for any support teachers or non-teaching specialists that tend to travel from school to school, same with substitute teachers would be another example of staff that move from school to school. Their schedules are being limited to a particular family of schools. So we are dealing with that situation, minimizing risk through scheduling, making sure that those folks are not going beyond their family of schools.
Go ahead with your follow-up.
So I hope this doesn't count as my follow-up. So every school will be in a family of schools that is served by specialists.
Yeah, that's how it's organized right now. Yep.
And COVID-19 is the same everywhere throughout the province, but we're being told that the RCEs, a lot has been left to their discretion in terms of implementing measures and what it's going to look like. My question is, what are some examples of things that have been left up to the RCEs, And why have they been left up to the RCEs versus standardized?
So in terms of what the department does, we set the general legislation, budget, guidelines for the entire system. And when it comes to public health and safety guidelines, those are universal, and those apply to every single school and every single student. And those are the guidelines that we've talked about around mask sanitization, hygiene, all those sorts of things. Our operational staff, which are at our regional centers of education, and even if you go down further at our schools, they support the implementation of this. So, you know, something that might vary from school to school is, okay, an example is you know, lunch or recess. So everyone is not going into the cafeterias for lunch. So lunch is going to be provided in different ways. And that might look different from school to school depending on their staff, depending on how much lunchtime supervisors they have, et cetera. Recess. Some schools may have quadrants on the playground where the cohorts of students have to go. Some schools may be staggering recesses. These would be kind of examples of local decisions around the implementation of the broad health and safety protocols, at least the ones that come top of mind.
Next, we'll go to Steve Gowell from News 95.7.
I guess this would be for Mr. Churchill. As the teachers union has sort of said, under the bargaining units, cleaning doesn't really fall as a teacher's responsibility. I'm just curious how and who will sort of manage the differentiation between sort of cleaning versus sanitizing between and during classes, and how that information is being.
Listen, we all have to step up a bit here and do our part. So we are hiring more cleaners. We've hired more cleaning supplies. And those folks, of course, are going to be deployed to conduct the general cleaning. You know, we are looking at support from teachers, for example, spray down desks in between classes, and you know, maybe students wipe them up, and someone comes around with a basket. So I mean, there's little things that we all can do to make sure that our back to school plan goes smoothly, and that it's safe in our schools, and something little like that can go a long way.
Go ahead with your follow-up.
Dr. Strang, I guess this is for you. You said there was 961 tests yesterday.
Yes.
I just noticed that in the last few days there's been an increase in tests. I'm just curious if that is, you know, a result of students coming in, or if you can explain sort of what you've seen.
That's the testing we're doing with university students.
That's Strang-related.
Yeah.
You will now move on and take questions from the phone lines. We have approximately 8 reporters on the phone. Again, we will try to take as many questions as we have in the allotted time that we have for today. We will start with Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. I wonder if you could just elaborate a little bit on the children who are supposed to stay home because they have symptoms. Can you be a little bit more definitive on what the symptoms would be? You know, many children have sniffles, and then on the backside of that, is there the 811 staff to handle, say, 5,000 children who call in the first day because they have the sniffles?
So we have a standard list of symptoms that are on, people go to the 811 online assessment, or it's also on the coronavirus website. We continue to look at that and say, is that the appropriate list of symptoms? And we're looking at that actively right now, and to both at a national level and locally, to say what are if we want to make sure that we capture people who could have COVID, what are the list of symptoms we need to look at? But you know, 811 has shown it has substantive capacity, so I fully believe we have the right capacity, or have the appropriate capacity, and with the ability to deal with next week with school opening. The standard message is, I don't want people to memorize a list of symptoms. It's really people focus, that list may change over time. We've already changed it a couple of times throughout COVID. So the key message for people to understand is that if they or their children are feeling unwell or they develop new symptoms, so this is not about a kid who gets, that has seasonal allergies and gets a runny nose every September or has chronic headaches, whatever. These are new or a worsening of existing health symptoms. So if they're feeling unwell or have new or worsening of existing health symptoms, they should be isolated at home and then do the 811 online assessment. Or if they don't have internet access, calling 811. And then 811 it has the up-to-date list of symptoms that if any of those are identified, that triggers then a requirement for a recommendation from 811 for testing.
Before we move forward, just a reminder, if you're not asking a question, please have your phones on mute. Tim, go ahead with your follow-up, please.
Yeah, this might sound a bit strange, but I feel like I've been kind of overly cautious. This low-risk analysis that you're giving, a lot of us are walking down the street fearing the person we're momentarily passing coming towards us and jumping out from the sidewalk into the street. And, I see this, I'm on Spring Garden Road today, and then people seem downright fearful of each other. Are we perhaps overstating the risk in our incidental contacts?
I think we have to understand. We want to maintain, keep separated from each other as much as possible. So if you're able to move to the edges of the sidewalk to keep apart from each other, that's entirely appropriate. But we know that this virus is not exchanged through very brief casual contact. People just walking past each other, even if they may be well within that 6-foot space. It is passed between people who are in close contact, in closed conditions, and that the contact is sustained for a period of time.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thank you. My question is about testing, and it seems that in the case of students who may need a test, the onus there is on parents, and I was wondering about the possibility or whether it was considered of doing testing in schools. We've seen it with university students being tested in their dorms at Dalhousie. And especially, if there's an outbreak, I would think it would be similar to lice checks, vaccines, even fluoride that students get, and those are all done in schools. I'm wondering if that's something that would happen if there's an outbreak or an exposure.
So if there's an isolated case, we wouldn't be testing in school, because the most important thing is to get that child or that teacher out of school and back home, and then get them to do the assessment and then go for testing as appropriate. Certainly that if we got into a large outbreak situation and we needed to test lots of kids, there's certainly the possibility that we may reach a conclusion that the most appropriate thing would be to bring testing access to testing into that school environment. We saw that in our first wave of COVID-19, not in schools, but when we had significant activity in the community, rather than expecting that community to go to testing, we brought testing to the community. So that is certainly possible that we may reach that conclusion in a school, but not around an isolated case.
Go ahead, Victoria, with your follow-up.
Yeah, my next question is about physical activity for students and getting outside. We talked a bit about space on playgrounds for them, and I was wondering about whether there's rules around the sanitization of playground equipment specifically, or physical activity equipment, things like that are outdoors, but still that students are touching on a daily basis, most likely.
So I think we have to understand both, whether it's playground equipment or pieces of paper or books, there's a lot of attention paid to those. I'd like people to focus on more what is the cleanliness of the hands, if you will, that are touching those objects. If kids are out playing, and we actually are promoting, whether it's not just recess or phys ed, but actually other classrooms, get outside as long as the weather's nice. It's much lower risk for COVID for anybody to be outside. So get outside. If they're on playground equipment on recess, all they need to, that's why we have protocols in place that when they come back in, everybody's hands gets washed. The same around, books and papers in a classroom. If everybody's hands are well sanitized or washed as they enter the classroom, then I'm not so worried about as they're then touching books and sharing some things. So it's not that we don't need appropriate cleaning, but let's focus a lot more on the cleanliness of hands and not worry so much about pieces of equipment and books and pieces of paper.
Next, we'll go to Ed Halverson from QCCR Radio in Liverpool. Go ahead, Ed.
Yes, my question is for Minister Churchill. Minister, you said that any student sent home will be supported, and some of that, of course, will be online learning. Are teachers expected to provide classroom and online instruction simultaneously?
Well, teachers do that now. If students are out for extended periods of time, students are given, a learning plan and provided with the support that they need to keep up with their studies. So, that is a process that we have in place now. And we've provided additional support to teachers if they need help enhancing their skill set with remote learning, either for a small number of students that they're supporting, or if we move to an at-home learning model, all of their students. So we have, as I mentioned earlier, we had about 1,000 teachers engage in professional development this summer that we offered. We have 100 free courses online right now that teachers can access if they need additional help around management of that teaching. We also have now standards in place for remote instruction, and we did not have this guiding document to support teachers last year. So we, of course, learned a lot from last year, and we're better positioned to support our teachers and support our students in the event that a small or larger amount of students are learning from home. And, of course, we have additional teaching and non-teaching support staff that can be deployed to support that learning.
Go ahead with your follow-up, Ed.
You kind of touched on my follow-up with your statement there, Minister. I was wondering, perhaps is it less a matter of education skill development and more a matter of just the time in the day? Will teachers have the time in the day to support students both online and in the classroom?
I think yes, I believe that's something that our teachers can handle. I think they do that anyway. And as I mentioned, we have additional staff in place to provide that extra help if it's needed. And that can be, from a teaching assistant to a child and youth care practitioner to a mental health clinician to a speech language pathologist. There's a whole range now of non-teaching supports that are in place in our schools that weren't there before a few years ago. Guidance counselors would be another group of staff that can be deployed in these sorts of ways. I mentioned earlier we've also changed our attendance policy for this year so that if students are out of school for a prolonged period, they cannot be penalized academically. So that's another support we have in place for students in the event that they do have to remain home as well.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. This question is for Dr. Strang. Dr. Strang, I wanted to ask you about the Quebec Major Junior Hockey League, and in particular, I guess, the maritime teams that will be competing in the regular season. I'm just wondering if you can update us on perhaps what the plan looks like from a health protocol, any regulations, and how the season might look for the hockey teams.
Well, how the season looked, that's really a question for the Quebec League. They've divided up into a Quebec division and a maritime division. So certainly the Nova Scotia teams will only be traveling to New Brunswick and PEI. They have appropriate, they've had appropriate quarantining protocols. They have a robust protocols of return to play for their players, and we've approved plans for the two arenas in Nova Scotia, Scotiabank Centre and Centre 200 in Sydney.
Go ahead, Jesse, with your follow-up.
Okay, I appreciate that. I guess I'm just looking for more specifics. Is your role, have you signed off on a plan then? Will games only be played at these two facilities, and what will it look like at these facilities?
Well, those are their home arenas, and I've approved, and the plans to accommodate the crowds in a safe manner with the direction we've given around groups of up to 200, and each group needs to be kept separate. They have been reviewed by my office as well as people in occupational health and safety within the Department of Labor Advanced Education, and those plans for the purpose of Quebec Major Hockey League games have been approved by government.
Next, we'll go to Zane Woodford from Halifax Examiner. Go ahead, Zane.
Thank you. Minister, you and your department repeatedly committed to having a publicly accessible database of test results for lead in schools' water supplies available by September. It's September 2nd, and we don't have it. So I'm wondering, when specifically will those results be public?
They will be up this month. I believe the vast majority of lead testing has already been completed, so we're just in the process of finalizing the database, and that will be up as per our commitment in September.
Go ahead with your follow-up, Zane.
I don't want to argue about it, but the commitment was by September. I'm hearing from the union and some teachers that there's no water available in some schools. So what's the plan to ensure that students have access to safe drinking water?
So there is, in every single school, there is access to potable water. I've been reassured that by our regional executive directors and by our department. So there are no exceptions to that I'm aware of. What happens is once a problem around water quality is identified, whether that's lead or something else, there's an assessment done to see if remediation is possible on the water system, whatever that may be, well, pipes, what have you. In the meantime, potable bottled water is provided to school communities. So they all have access to potable water.
And that's all the time we have for questions today. Thank you, everyone, for coming. Minister, anything else?
Thank you very much, everybody. Really just want to emphasize my thanks and appreciation to all the partners that came together to put this back-to-school plan together: Public Health, IWK, the Nova Scotia Teachers Union, CUPE, the NSGEU, other unions that represent staff. And we're really excited to get our kids back to school. We're in a very lucky position, thanks to the guidance and direction of Dr. Strang, to be where we're at from an epidemiology perspective in Nova Scotia to get our kids back safely. And just a reminder to all the adults that are having conversations about back to school, let's just remember that our kids are watching how we talk about this, and they're taking their lead from us in many circumstances. So let's be mindful of that as we talk about our anxieties heading into next week and as we manage them. And let's be good role models for our students. I think we can have a really successful year, even with all this stuff hanging over our shoulders. So thanks again to everybody who put this plan together, our staff, our custodial staff, our principals, vice principals, our teachers, our operational folks who all came in early in the summer to help get ready for next week. And we're very excited to be where we're at and look forward to welcoming our students next week.
Thank you.